Good afternoon. My name is Lynn Johnson. I'm chairman of the Orleans County Legislature, and welcome to our Zoom conference today. With 30 million Americans filing for unemployment because of the COVID-19 pandemic, people are facing another challenge that comes with losing their jobs, and that's putting food on the table. There's nothing more important than providing food. People have to eat. We have people who are hurting very much. Not only do we have homelessness, but we have people who are laid off. We have people who have been laid off for the first time probably ever in their life. To help county residents who are struggling purchasing food, FoodLink, with the help of Melissa Blainer from Office for the Aging, Annette Finch from Community Action, and Donna Poor from Calvary Cupboard, are holding a series of emergency drive-through food distributions. We had one today at the 4-H fairgrounds, and when I was updated, over 800 boxes of food, and this is our fourth one, I believe, were given out. And I just was also told that we are going to continue doing this every Friday until the end of July. And the people there, I was told, say thank you, but you can see the look on their faces. They're very much appreciative of what we're doing, but they don't want to be there. They'd rather be working and providing their own way. We're feeling the economic devastation here, and we have a lot of small businesses, a lot of mom and pop shops that up until today, actually up until 1 o'clock today, weren't able to work. And we finally did get the clarification from the governor's office that phase 2 opened at 1 o'clock this afternoon. But it's going to take a long time to recover. So the more we can help get food to people, get resources where they need to go, that's why we're all here. To hold free food distributions as well as deliveries for county residents in need has been amazing in Orleans County. Recipients drive through, food is placed, they pop their trunks, the food is placed in their trunks, and off they go. So it's all very sanitary. Masks, of course, on. Socially distancing is being done. You have people who have been living check to check, and even if they had another month's worth of funding to pay their bills, they're out of those funds now, and that's why you're seeing the different categories of people coming in. The last food drive, you're seeing people that aren't poor and homeless. They're the people, like I said, that are living paycheck to paycheck. But it's ground level roots helping out ground level people. And we appreciate the 3 organizations that volunteered today. And we're going to be asking for volunteers to help on these Fridays food drives. The police departments have been wonderful with the detours and the cones that they have set up, directing people in, but they become more popular the longer that people are out of work. So with that update, I will turn it over to our Public Health Director, Paul Pettit, for today's COVID update. Thank you.
Thank you, Chairman Johnson, for those words and keeping things off on this Friday afternoon. Welcome, everybody. Again, my name is Paul Pettit. I'm the Public Health Director for Genesee and Orleans County. And we find ourselves here again on another Friday afternoon talking COVID-19. So I'm going to do my typical thing here, kind of run through some of the numbers, brief updates, and then obviously if there's any questions from the press, specifically to the information we're sharing, we're happy to answer those, or we will get those answers for folks if we do not have them readily today. But as I start, I just again wanted to acknowledge and reiterate what Chairman Johnson said. We are formally in phase 2 now in the Finger Lakes region, so that again is something to celebrate. Small victories as we move forward, as we talked about 2 weeks ago, as we enter phase 1. It's been 2 weeks of tracking data and monitoring, and as we've seen the numbers day by day and track them, we're doing fairly well overall, especially with community spread in our region as a whole. The numbers continue to trend downwards. Bed availability, hospitalization rates, et cetera, remain much lower than the red indicators push us to potentially pause again. So that's all good news, and as I've said many times, as I stood here on the Friday afternoons now, I want to thank the residents of Genesee and Orleans County. It's not easy. It's not something that any of us, myself included, want to be doing with these stay-at-home orders, the social distancing requirements, gatherings less than 10, et cetera, especially as the weather has gotten nicer. It's been more challenging and difficult to want to adhere to the different guidelines that are out there, but the hard work that everybody's been doing is working. The numbers have stayed low, transmission rates are low, and it has allowed us to continue to move forward with reopening. So we're very happy to see that, and again, want to thank everybody for their efforts. And we're very pleased again to be moving into the next phase, and hopefully this path will continue, and we'll continue to move forward to phase 3 and 4 in a short time here. And again, we can get back to some sense of normal here in the near future. All right, so what I'm going to do is again run through some updated numbers for everybody, some additional information, and then we'll again open it up for questions. So new cases, again, this is as of 2 p.m. That's our cutoff for reporting for the day. For Genesee County, we have 1 new positive case of COVID-19 for a total of 186 cases since we started tracking. The current positive case resides in Batavia. The individual is in their 20s. The positive case was on mandatory quarantine before becoming symptomatic. And 2 of the total active cases currently in Genesee County are hospitalized. So flipping over to Orleans County, Orleans has 10 new positive cases of COVID-19 for a total of 221. Again, that is 10 new cases today. 1 of the new positive individuals resides in Albion. 3 of the new positives reside in Ridgeway. And 1 of the new positives lives at the Villages of Orleans Health and Rehabilitation Center. And 5 of the new positive individuals live at the Orchard Rehabilitation and Nursing Center. Of the new positive cases, 1 is in their 20s, 1 is in their 30s, 2 are in their 50s, 2 are in their 60s, and 3 are in their 70s, 1 in their 90s. So again, that's all broken out in the chart further down. 2 of the positive cases were on mandatory quarantine prior to testing positive. 1 of the previous positive cases has recovered and has been released from mandatory isolation. So it's always good and welcome to be able to report that number when we can move someone off of isolation into the recovered category. 19 of our total active positive cases in Orleans County are hospitalized. Again, that number continues to stay fairly high. Please note those that may be in the hospital, may be from the community or a regulated facility. Again, we do not break them out in line with HIPAA and protecting those folks' privacy. And then lastly, again, in the update here, it is unfortunate again that I have to report that we have lost 2 more county residents due to COVID-19. So again, 2 more deaths being reported today from COVID-19 in Orleans County. Both of the individuals resided at Orchard Rehabilitation and Nursing Center. Again, our deepest condolences to those family members and friends of those that we lost that they mourn during this time. All right, so I'm going to go through some cumulative numbers, and as I typically do here, just to kind of read across so we get a baseline of where we're at right now. So as I do that, the screen's going to come over to our trackers website here. So folks, again, we've been encouraging people to go to this site. It is updated Monday through Friday. So we would encourage you to go there and get the most up-to-date information that we have available. Again, it does a great job of tracking numbers and trends. You can see really what's going on in the community, both total cumulative cases and active cases. So for Genesee County, again, we're at 186 positive, 3,310 negative, 12 people are on isolation. We have 67 under quarantine, 4 total deaths, and 119 have recovered. Orleans County, we have 221 positive cases, 1,973 negative, 16 under isolation currently, 50 under quarantine, 36 deaths, and 73 recovered. All right, so again, as you look at our press briefing sheets, you'll see that, again, we have our cumulative age by breakdown for both counties. And again, we have our non-county public regulated facilities map. And just as a reminder, this chart here is specifically only showing the facilities that we have confirmed positive cases for. So if the facilities in either county are not on this list, it's thank goodness, and hopefully we'll continue that we do not have any positive cases within those facilities. And also, just as a reminder, we do not track the folks in there for isolation and quarantine. That is regulated and done by whatever the authority is, state of New York, federal, etc. All right, so as we mentioned, phase 2 is now upon us in the Finger Lakes. With that being said, there still are a lot of limitations. This is a very, very fluid situation. We've been reporting this as we started to ramp up and look forward to even phase 1 a few weeks ago. But things are changing rapidly. Again, unfortunately, we're not able to relay information any quicker than really it's being relayed to us live on TV by the governor from day to day. It makes it very challenging and frustrating, not only for you folks, but also for us, who are trying to keep track and make sure that the most factual and up-to-date, timely information is being relayed and given to our local residents so that they can make informed decisions and really know what the current status is in the state of our region. But with that being said, we do want to continue to send folks to the Forward New York website. That's about the best site we can send anybody to. We take many, many phone calls in our health departments on a daily basis, and usually they end up with Forward New York in the conversation at some point. This is the primary website the state has set up. It has a lot of information. Unfortunately, maybe not as much as everybody would like, but there is a lot of information there on the different phases, the process. There's different information on there on, getting folks the data that they need to be able to prepare and put together their plans. So we really want folks to go there and click on that. I believe we're bringing that up. So hopefully everybody can see what that website looks like. As you go on there, again, there's a lot of different information. Phase 1, again, broke out all the different type of facilities, the different businesses that were open and what their limitations were. There's an attestation form that folks can fill out, basically a test that they've read all the different guidelines. And there's a lookup tool that's available. Again, if you're a business or an organization, you're not sure where you fit in. Are you in which phase 1, 2, 3, 4? Again, you may have some unique characteristics to your organization. The lookup tool is a great place to go and put that information in, and hopefully we'll give you the information, give you some feedback on where you may fall. And if not, again, there is a website that people can ask questions to get better clarity if it's not provided when you look up. In addition, on that website is a fillable plan, a template that is available. And as we've been talking about for several weeks now, one of the requirements for reopening is every business, every organization, again, doesn't matter really what discipline you may fall in, you're required to have a plan to reopen. The governor has made it clear that these plans are to incorporate all the different aspects that we've been talking a lot about: social distancing, masking, face coverings, spacing, capacity within the facilities, those type of different parameters, enhanced cleaning. Again, making sure you're protecting your employees and those consumers or those that utilize your facilities. So it's imperative that folks take the time to go through and develop a solid plan. Again, the template is there. It covers all the areas I just mentioned and more. And it's really meant to be a blueprint, not the all-in-one guide. Again, everybody needs to customize it for whatever they have within their facility to make sure it fits. Because again, they're all different. Logistics are different for every place. How you interact with consumers or parishioners, whoever may be utilizing the facility, is different. So again, use that as a template. It is there. It's downloadable. You can fill it in. And you do not have to submit that. It is not required to be reviewed or approved. It just has to be available if someone asks for it. So no matter what phase you're in, whether you were operational before phase 1, in phase 1, 2, 3, or 4, or beyond, I guess, you need to have this plan. So everybody should be filling that out. What we've seen a lot of is, tweaks going on to the governor's plans here in between phases. Obviously, last time we saw faith-based organizations get added in to phase 1. 10 or less within the facility. So I guess my advice here is everybody should be ready. There may very well be some modifications in other facilities or other functions may be added into phase 2 as we go through the time period. So the biggest thing is be ready. So when and if we get that word, you're able to go immediately. You don't have to wait on that, and you can get up and running as quick as possible. That's what we all want to see, is all of our facilities and organizations, back up and operating as quick as possible and as safely as possible. All right, so definitely utilize that website, the link's there, and hopefully folks are finding that as informational as they can. Again, I realize not as real time or maybe as fully informative as we'd all like, but at least it's better than something. Also, just a reminder, per Governor Cuomo's orders, again, gatherings of 10 or less are still, that requirement is still in place. Social distancing, sanitation protocols need to go along lines with that. And this is in line with his executive order, again, that was renewed for 30 days, and I believe now it expires on June 21st. So again, unless he changes that, that's his order as far as gathering sizes. So this, again, is related to all non-essential type gatherings. They have to be restricted to 10 or less. So it's important, again, that we just keep pushing that number out there. And, again, we're asking folks to adhere to that guideline as best they can. So we talked about the regional control room a little bit for New York website. And again, the control room is meeting on a daily basis. They have daily calls. And again, we have representation locally from our chief elected officials, both Chairman Johnson and Chairman Stein. Genesee participate daily on that call. We do have public health folks from the region represented on that call. And again, that's where we're really tracking this data and making sure that we're doing our best to keep numbers down so we can keep forward. There is an opportunity, again, if folks need to file a complaint, they have concerns potentially of businesses open when they shouldn't be, if, there's concerns about large social gatherings, again, that information is available. There's both a phone number and a website link that people can click on if they feel compelled to file a complaint. Again, that goes up to the state and comes back down to the local law enforcement agencies. And, the typical approach here is to go out and educate and try to inform people of what the rules and the executive orders are and gain compliance. All right, so again, there's a lot of other information there. A few areas I just wanted to highlight real quick. Campgrounds, so this has been a lot of discussion for the last couple months, and we did receive word, and I know the governor put it out on Monday, that effective Tuesday, campgrounds were open. So throughout the week, we've continued to seek guidance on that. Again, no clear guidance really seems to come fairly real time to us. And even though we ask every day and continue to push at many different angles for this, but what we have found out is that, again, campgrounds are open, state campgrounds and private as they have been locally, but it is expanded now beyond these self-contained units. So tent camping, pop-up, et cetera, those are all allowable now. The bathhouses and the bathrooms are open. Essentially, the restrictions that are in place now at campgrounds are the pools are still required to be closed. Any of the playgrounds in these facilities need to remain closed, and any of the common areas, including if there's a food service establishment, et cetera, it's only takeout at this point. And again, the main restriction there, again, still goes back to that gathering size. It has to be 10. Visitors are allowed to visit, again, as long as you're staying under that 10 or less in gatherings at the campsite. So again, that's good news. We're making progress here with the campground setting. So we have been corresponding through the health department with all our local campgrounds, giving them updated guidance on this. But I just want to report that out here today so everybody was aware. And we are heading into another weekend where I'm sure a good many folks will be out utilizing the different campgrounds and different amenities we have in our region. Also, hair salons and barbershops, that's also been a big conversation over the last many weeks and what phase they'll fall in. We did obviously receive clarification that they are in phase 2 and they are open now, again, able to provide limited services. I'm not going to go through all of them now, but they are available on the website. What's currently allowed and not allowed, I guess, within these settings. Again, the governor announced all of this a couple hours ago, so we're still trying to sort through, wrap our minds around exactly what he's put in place. But we do know he did mention that there will be required testing of barbershops and hair salons employees every 2 weeks. for COVID-19. Again, not a lot of detail on exactly how that looks or the reporting on that, but similar to the nursing home employees who are required to be tested 2 times per week, he apparently has put in place a requirement for testing every 2 weeks for those folks. Again, as we find out more information, we're going to be we'll be sure to share that in these daily briefings, push that information out. But again, no real clarity on exactly how that's supposed to occur, again, or tracked, etc. But we will try to communicate that one. All right, so again, we've talked about the website we want to send people to. Just a couple of reminders here around, we talked about the complaint line. Restaurants, again, still remain in phase 3. We've seen different things around the region of the state with restaurants opening up, potentially outdoor seating. Again, it is still prohibited in the governor's executive order, even to have seating outside for folks. We are pushing hard. This is something, again, we would like to see as a potential option here, open up. But again, we don't have the ability to open these override the governor's executive order. So we're still asking our facilities to be patient as we push for this. We know it's very challenging, but we're doing our best to try to get some relief in these areas. So again, this may be one of those mid-phase adjustments that he makes. There's a lot of pressure to start allowing this. So, but at the moment, that is still prohibited and targeted for phase 3, which again, if our numbers stay where they need to be, that would occur potentially 2 weeks from today. All right, let's see what else we got. So again, on our list here, we have a lot of different websites that are available. We've talked about a lot of them, but there's emails and links. So we'd encourage you to utilize them as needed. Take advantage of them. They're all there in one spot for you as you need to try to find out different information on all different kinds of things from, again, the business lookup tool to private beaches and public beaches. There's also a COVID-19 test locator, test finder link there. So again, a lot of information available if you're looking for it. Okay, a few other things, mask and face coverings. Again, the supply remains very low within the counties, at least from the emergency management side. Over the past couple of weeks, obviously, there's been a lot of handouts of these masks at different locations around both counties. At the moment, I am not aware of any additionally scheduled ones that are potentially available for folks. If and when they do become available, we'll make sure to push that information out and make sure the public's aware of where they can go and get that, potentially get those supplies. But at the moment, neither county has any type of inventory to be able to hand out any more publicly. So again, stay tuned for more information on that as it becomes available. I, again, want to remind folks if they are interested that we do have the ROC COVID-19 health screener website that folks can go to and put in their daily symptoms into that. It's a symptom tracker. And again, this is a regional based project that will take into account symptoms of folks. Again, even if you don't have COVID symptoms, there's an opportunity to put that in every day. And that number, that data gets crunched as an aggregate regionally, and then it allows us to see zip code data. So again, if folks we're starting to see potentially some increase in activity in a certain area, it could allow us to potentially go in and offer targeted testing or some other type of intervention. So again, swabbing the antibody testing, we've been talking about this week after week after week. Again, things seem to be opening up a little bit. Unfortunately for Orleans County, I don't have better news again this week that we had more of a community-based testing site available. Again, some providers are doing that locally, but if you're not necessarily a patient of that provider, you're unfortunately going to have to travel. There are locations in Genesee County, including Well-Now Urgent Care and UMMC's Tent City down at the main campus that are doing community testing. Also, again, regionally in Rochester, Buffalo, Niagara Falls, there are many sites that are available that folks can go to. Again, we continue to push for more access, but in the meantime, you're unfortunately going to have to travel. Again, Genesee County, same story, a little more regional or county-based community testing, but again, not as widely available as we would like. We continue to push for that. We'll continue to provide information as that comes along. Again, as I wrap up here before I turn it over to questions, I just want to again throw out the reminder for the mental health piece. This is something we really want to hit on every week and make sure that folks are hearing that there is resources available. People are struggling and dealing with any type of mental behavioral health issue. there is help in our counties. Our mental health departments, other private providers, substance abuse providers are available, and we want people to feel and know that there is an outlet for them. They're not alone. Make sure that you're calling 24/7. Again, we have our care and crisis helpline. Take advantage of these services if you need them. We don't want anybody to be in crisis and to have any negative situations occurring. So please take advantage of them. That information again is there. So with that, I'm going to unpause our media folks, and I'm happy to take any questions. And if I can provide answers, I'll do my best. And if not, as I mentioned, we will get those back to you through our PIOs. We can push that information out. And again, if you have any questions, please state your name and affiliation, and we'll go from there. Thanks.
Hey, Paul, it's Howard Owens at the Batavian. How you doing?
How are you today?
So I want to go back to the restaurant issue. You talked about pushing for that. I would maybe put a finer point on it. Based on your knowledge, experience, do you believe that outdoor dining at this stage should be considered relatively safe?
Yeah, I mean, that's a good question. I've been asked that a lot. And, when we look at the public health perspective, I think that, as you get into discussions around outdoor seating, there is definitely a safer way to offer this, right? So, and we've talked to some other restaurants around their plans for offering this type of service. And, I think a lot of our restaurants have done a great job of coming up with strategies and ways to limit capacity, to limit exposure, obviously taking into account social distancing, having requirements around, even same family dining only, those type of things. So when you take into account the public health perspective and you put in the social distancing, I do believe that this can be done in a safe way. Again, if it's monitored and overseen appropriately. So that's why, again, we've been advocating locally that this is something we do believe should be allowed. Again, with the controls put in place. Unfortunately, we don't have that ability to give the official green light on that, and that's why we're strongly advocating for it, and hopefully we'll get some relief on that soon. But we would encourage all the restaurants or establishments that may be able to have that option to be thinking clearly about how they could potentially implement that here maybe in the short term, along with thinking obviously internally when we get to phase 3 formally, how they are going to potentially allow different folks back into their restaurants and make sure they're meeting all the safety guidelines.
The other question I had is, and thank you for that. And the other question I had is Buffalo Federal Detention Facility. We haven't talked about that in a while. It's been several weeks since they peaked out at 49 cases. They've held steady there. What are your thoughts on how they've been able to contain it at this point, not have it spread beyond those initial 45 that they kind of got in that one pod?
Yeah, so you're absolutely right. We have not had any cases, and it's probably been at least 3 or 4 weeks now, I would think. Anyway, since we had our last cases there, we saw a real quick spike there, a high cluster in a short 2 to 3 week period. What we do know is, I can speak from the conversations we've had with them, they were very, very aggressive in locking things down. They put in a very aggressive containment plan and isolation plan within the facility. Without getting into the weeds too much, it had requirements around corrections officers, et cetera, working in one area. They were wearing N95s, gowns, other types of PPE, very high level, and I believe there was a lot of discipline around making sure that they were following the proper procedures and isolating those cases. And obviously it's been successful, as we have seen really no additional activity in there, and we're not seeing any activity necessarily on the community side from workers in there at the moment. So they did a great job, and we're very happy to see again that the cases didn't continue to spread throughout the facility.
Do you think that is instructive for the rest of society as we open up, that if you take the precautions, you can help control the spread? Yeah,
absolutely. And that's really what we've been trying to talk about, daily in these press briefings and on Fridays when we talk. That's really the whole point on the masking or the face covering approach, the 6-foot separations, the increased hand washing. The more as a society we can, practice these behaviors, the better we're going to be in limiting and minimizing that spread. I know it's not the norm that we're used to. It's something that a lot of us have had to start getting used to as we're moving forward. But if we want to keep these numbers down, we want to make sure as we move forward, we're in a position to keep the data good and keep moving from phase to phase and beyond into the summer and fall. It's very important that we, do our best to, practice these type of disciplines as best we can.
Thank you, Paul. Have a good weekend.
Thanks, Howard.
Paul, it's Tom Rivers with the Orleans Hub.
How are you?
Good. With so many things being canceled this summer, I guess people probably wonder, is there anything, I don't want to say to look forward to, but in terms of a community gathering, realistically, I wonder what could happen in terms of crowd size and the type of activity.
Yeah, I mean, that's a tough one, Tom, and it is very disheartening and sad to see, obviously the last couple of days in the paper, our well-attended and beloved local 4-H fairs in our counties have made the decision to shut them down. Obviously, those of us that love sports and even activities, with school-based sports through the spring and summer activities, camps, other things kind of being closed down. It is very disheartening and it's very, sad. And it is for myself and who likes to participate in these different activities myself. So there is a great loss here for our community, and not being able to participate in these activities and have them, unfortunately go forward. And, it's, I guess I have a magic answer for the question per se, but, hopefully as we march forward here, we can get back and get some things open. We can start going back out to eat a little bit. We can hopefully maybe see some relaxing of some of these size restrictions. Again, currently limited to 10. I mean, that's not a very large gathering, right? Over time, we're hopeful that, we can start to see that number expand a little bit in that it may provide for some additional activities and opportunities throughout the summer. I guess it's one of those things we have to get creative and think back, some of the old days without the technology and activities, the different ways we can, enjoy one another's company in new ways. And it's going to be a bit of a challenge, but, I think it's something that, again, as we rally together and we figure out our way through this together, hopefully we can find some reprieve and some joy in the activities we do have available this summer.
Yeah. Have you got an indication if the crowd size might increase the next level to 50 or 25?
There hasn't really been any communication on that. Logically, we kind of went down, as you kind of mentioned, down to that 50%, then I think it was 250, then 150, kind of slowly down to 10 where we're at now. We've been at for a couple months. There really hasn't been any indicator of how that number would expand back up. I think, again, logically, it could be 25 and then to 50. Obviously the logic is the more people you put together, there's a higher likelihood of someone in that mix or multiple people in that mix being positive for COVID. And again, if there's, folks not adhering to the social distancing gathering rules, as far as 6 feet, or they're not wearing face coverings, there's a higher likelihood of transmission. And what we don't want to do is get in a situation where, our contact tracing is now, we're looking at 10, 12, 15 potential households where people may have been exposed at gatherings and things. It makes it very complex and really can start to increase spread within our community. So no indication, but we will be sure to share that as soon as we find out any information on that, if and when that may happen. But as mentioned, I believe the current order, unless change, goes through June 21st.
Yeah. I guess my last question, people, they are actually bent out of shape about this, the garage sale issue, that you can't go to a garage sale or a yard sale. And I don't know where that fits in the phase rollout.
Well, yeah, again, very, very gray and nothing really definitive. I'd love to give an answer. Again, this is one of those things we keep asking. And, my hunch would be that'd be a phase 4 activity. Again, I think you're looking at, a lot of folks mingling, common areas, touching surfaces, hard to control social distancing in those settings. So there's a lot of parameters that I think go against the current requirements, which is why, they're not currently allowed. So again, we're pushing our best to get these answers, and we'll provide them as soon as we can. And we do understand it's very frustrating. I have these conversations every day. I'm frustrated by them. And, but we're doing our best to balance, again, good public health and safety with trying to safely open things back up and keep people protected while we do it.
All right. Thank you.
Hi, this is Mallory Diefenbach from the Batavia Daily News. I was wondering for the food link thing that was mentioned earlier, where is that exactly and what times was that?
Mallory, I don't have that information right in front of me. I think Lynn's already left, but I believe it was at the 4-H Fairgrounds is where they were doing the distribution today.
Mm-hmm.
And get you the information on the future dates because I know that's going to be going forward for quite a while, but we'll make sure we get you that information.
All right, excellent. Thank you.
Any other questions? All right, well, again, I want to thank everybody for their time, and we're going to continue to push this information as real time as we can. Encourage you to visit forwardnewyork.gov. Again, that's going to be the most real-time best information that's going to be available for folks. And again, enjoy your weekend, continue to practice social distancing and wearing your face coverings. And again, to our phase 2 category establishments, be safe. Hopefully it'll be a great weekend for you with folks starting to, again, utilize your facilities as we get back to some semblance of normal. So have a good weekend and thank you.